Do you ever feel like there's a soft lump under your skin that doesn't hurt, but just won't go away? Or maybe your child has a bulge in the neck or tongue that looks like a water-filled bubble. That might be something called cavernous lymphangioma. It's not a heart problem, but it can look and feel confusing. This condition is a rare, non-cancerous growth that forms when tiny tubes in your body called lymph vessels don't develop properly. Instead of carrying fluid away, they swell up and create a spongy, fluid-filled lump. It often shows up in babies or young children, usually in the head or neck area. Think of it like a small water balloon stuck under the skin. It's soft, can grow slowly, and sometimes gets bigger if it gets infected. Not dangerous in most cases, but it can cause concern because of how it looks or where it's located. So why does this happen? Imagine building a plumbing system, but one pipe is blocked or missing. That's kind of what goes wrong with lymph vessels in cavernous lymphangioma. The exact cause isn't always clear, but it usually happens before birth, during a baby's development in the womb. The lymphatic system, which helps drain fluid and fight infections, doesn't form right. Some tiny channels become blocked or clumped together, creating a pouch that fills with clear fluid. It's not caused by anything a mother did during pregnancy. It's just a random glitch in development. Sometimes genetics might play a small role, but there's no evidence that food, lifestyle, or infections cause it. Think of it like a birthmark, but instead of color, it's a fluid-filled pocket under the skin. Imagine your child has a smooth, swollen bump on their cheek under the tongue, or even on the eyelid. The lump feels soft and squishy, like pressing a water-filled balloon gently. It might not hurt, but if it grows, it could press on nearby areas. For example, a large one in the neck might make swallowing hard, or one in the tongue could change how they speak. Sometimes it gets infected, turns red, swells more, and becomes painful, like getting a pimple but deeper. In rare cases, if it's in the chest or belly, it might cause breathing issues or discomfort. These signs usually show up by age 2. If you've noticed any such lump in your child, or even in yourself, it's worth getting checked, not to panic, but to understand what it is. How do doctors know it's cavernous lymphangioma? First, they ask questions. When did you notice it? Has it changed? Then they look and feel the lump. But that's not enough. They might say, let's take a picture inside your body, not an X-ray, but an ultrasound or MRI. Ultrasound uses sound waves, like how bats see in the dark, to show if the lump is filled with fluid. MRI gives a super clear image using magnets, no radiation. Once confirmed, treatment depends on size and location. Small ones that don't bother anyone might just be watched. Bigger or bothersome ones, doctors might suggest surgery to remove it, like scooping out the water balloon carefully without breaking it. Another option is sclerotherapy, injecting a special medicine that makes the lump shrink. It's like deflating a balloon from the inside. Both work well, but sometimes it can come back, so follow-ups are important. Can we stop it from happening? Right now, no. Since it forms before birth and isn't caused by habits or environment, there's no sure way to prevent it. But here's the good part, parents, it's not your fault. You didn't cause it by what you ate or did. It's just a random twist in how the baby grew. The best prevention is awareness. Knowing what to watch for helps you act early. If you see any odd lump in your baby, especially on the face or neck, get it checked. Quick diagnosis means better care and less worry. Think of it like checking the smoke detector. You can't stop a fire before it starts, but early detection saves trouble. Science is always moving. Recently, doctors are getting better at treating cavernous lymphangioma without surgery. One exciting advance is using special foam in sclerotherapy. It spreads better inside the lump and helps it shrink faster. Think of it like using whipped cream instead of liquid to fill every corner of a container. Also, researchers are studying how genes affect lymph vessel growth. Maybe one day we'll predict or even fix the problem before birth. Another cool tool is better imaging. 3D scans help plan surgery so doctors can remove every bit safely. Some hospitals now use lasers for smaller growths, like using a tiny heat beam to seal off the abnormal vessels. These advances mean fewer scars, quicker recovery, and happier kids.